Hi, I'm Dr. O'Shaughnessy. I'm one of the reproductive endocrinologists at Conception's Reproductive Associates. It stands for hysterosalpingogram. HSG is a X-ray dye test that we do to evaluate the uterine cavity and the fallopian tubes. This procedure is done at a very specific time in the menstrual cycle. It's done right after you finished your period, but before you ovulate, so in that window, which can vary from woman to woman. The procedure itself has to be done in a radiological facility because we do take x-rays during the procedure, and we also use fluoroscopy during the procedure, which allows us to see the inside of the uterus and the fallopian tubes, and we actually get the results right away. So basically it entails putting a catheter just inside the cervix, and then we push radio-opaque dye into the uterine cavity. This dye will appear as a bright white substance. We can actually follow that into the fallopian tubes. So when it fills the uterus, it should take on a certain size, a certain shape. There should be no structures within the uterine cavity, such as fibroids or polyps. They will show up as dark circles, basically. And then the dye will fill the fallopian tubes. The fallopian tubes should take on a certain size and shape. If the fallopian tubes are dilated, that's abnormal. And then the dye should spill right into the pelvic cavity, and there should be nice spill. So sometimes if the dye just stays right around the fallopian tube, that can indicate some scar tissue around the fallopian tubes. So the HSG, what's nice about it, we will take x-ray pictures. So if you decide you want to go to another provider for a second opinion, you can take your films with you. You don't have to necessarily repeat this procedure. You probably will have some cramping, and that varies from woman to woman. We usually ask that you take an anti-inflammatory medication to decrease the cramping during the procedure. Some women, we ask that they start an antibiotic prior to the procedure, just the day before, and for about 5 days afterwards. And that's because there are some women who are at risk for infection. These are women who have a history of a previous pelvic infection.